Welcome to Adapting Class and thank you for joining us. Today is Wednesday. We're going to go over how to identify pharmacology and the GI system. And like I said last time we did, we're going to focus on easy way to remember the medication without memorizing. So you want to stick around and let me show you how I go about learning pharmacology in a different perspective. We're going to basically go with the buzzword and then we figure out what is wrong with the patient. So this is the first question. For information, there are buzzwords. You just have to look at it. And I give you multiple options. I did not give you a lot of options. You figure out which one belong to the specific description. These are questions the NCLEX will ask you. These are side effects the NCLEX will ask you. These are specific things regarding each medication. Which of this, okay, will give you the risks of what? Osteoporosis. You're likely to get C. diff if you take it. And pneumonia. Number two, which one will cause what? Asteresis, right? And high ammonia. And the goal is for 2 to 3 bar movement. So if you have all these things, which one do we have to use to help treat your asteresis, high ammonia, and the goal is to what? Let you have 2 to 3 soft bar movement. Which medication is an antidiarrhea? That means against diarrhea. And you shouldn't use it if you have C. diff or fever. The next one, which one causes diarrhea, right? And if you take it, you're going to have lip smacking and tremors. GI pharmacology in the most friendly way. This is the way the NCLEX take this information and put it in the question. I took the question out not to intimidate you, but to put it that this is what the question asking you. Which medication causes diarrhea and there is a risk of lip smacking? Or you're going to have tremor. Which of this? If you have C. diff, you should not take it. And which of this you can use to treat somebody who has asteresis, high ammonia, and then the goal is to give you 2 to 3 soft bar movement. Which of this will cause osteoporosis, C. diff, and pneumonia? If you know the answer, just put in the comments, but this is our luck. So thinking in form of all the information I've given you, you have to know a little bit of content. And these are your options. You have metoclopramide, you have lactulose, you have omeprazole, you have promethazine, loperamide, and famotidine. These are all GI medication. Are you having problem with that? This is the way to master them. Know the medication, know what is used for, the key things, side effect. The first one, osteoporosis. It causes C. diff. It causes pneumonia. The most common one is PPI. PPI are the most common cause of these side effects. Which of these is PPI? PPI has last name Zol. Therefore, omeprazole is one of them. That's the first medication. Second one, patient has arthritis, his ammonium is high, and the goal is to get your bowel movement 2 to 3. So which one can we use for this? If you have high ammonia, arthritis, that means what? Flapping tremor, right? And then the goal is to what? 2 to 3 bar movement. Which one? It has to be lactulose. Which one is what? Is an anti-diarrhea? You shouldn't use it with if you have fever and C. diff. Look at them. You have metoclopramide, promethazole, loperamide, and famotidine. Metoclopramide causes diarrhea. Therefore, it cannot meet the definition of anti-diarrhea. Famotidine can cause diarrhea, so it doesn't meet the definition. These medications, you shouldn't use it if you have infectious diarrhea. That's what it means. If you have infectious diarrhea, you shouldn't take it. And that is loperamide. Okay? And the last one, it causes diarrhea. And there's a risk of lip smacking and tremor. Lip smacking and tremor, this is extrapyramidal side effect. Extrapyramidal side effect. Which medication causes extrapyramidal side effect? Promethazine and metoclopramide. These are medication that can cause extrapyramidal side effect, right? Promethazine does not cause diarrhea. You see the difference? Therefore, the best answer is metoclopramide. I cause diarrhea and I can have extrapyramidal side effect. Promethazine will cause extrapyramidal side effect, but it does not cause diarrhea. Therefore, this is the right one. Okay, so this is the way we're going to go through all these pharmacology, GI pharmacology. The next one, next group of medications. Same strategy. Figure out what you think is the best one. You take it 1 hour before meal. You shouldn't take any antacid within 30 minutes, and it can cause constipation. Do you see any medication that can do that? It works very fast. You should watch for QT prolongation and serotonin syndrome. Do you see any medication there? It's used to prevent gastric ulcer. It's used when you take NSAID, and you should stop it when you're pregnant. It's an osmotic laxative. It causes diarrhea and it causes magnesium toxicity. What do you think? Which medication are we talking about? This is the way to look at it. Is it misoprostol, olanzapine, sucralfate, magnesium hydroxide, or docusate? What do you think? Olanzapine, you're supposed to know that it causes QT prolongation. That's number one medication that causes QT prolongation. Sucralfate is a cement, so constipation, and you should not take it with antacid. You should take it 1 hour before meal. So this is sucralfate. Pregnancy alone gives this answer choice away, but you use it to prevent gastric ulcer and use it with NSAID. Which medication? Misoprostol. And of course, osmotic laxative causing magnesium toxicity is magnesium hydroxide. So if you know the answer, you can put it up, but these are medication, GI medication I want you to be familiar with. And this is the way to summarize the content for you, straightforward, in an easy way, as much as possible. How about this one? Try your luck. I stopped the antacid, but it do what? It plug you up. Now you're constipated, right? That means you take the medication, it help with your acid disease, but now you're constipated. It can be used to bind phosphorus in renal failure patient. This medication is against diarrhea, but it can cause what? Tachycardia and dry mouth. This medication causes sunburn, kidney stone, and orange-red urine. Pharmacology is what these are the things NCLEX put in the question on side effect, next prioritization. What would the nurse do? What should the nurse expect? If I take this medication, I'm going to have sunburn, I'm going to have kidney stone, and my urine is going to turn into orange red. I take this medication for GERD. I can use it for ulcers, but I should take it at night. If I smoke, it does not work. What do you think? These number 12. You can see how I can teach the patient taking this medication is to not to smoke, take it at night, and when you have ulcer, take it. Then number 10, you see, if you have diarrhea, I can give it to you, but what is going to happen to you? You have tachycardia and dry mouth. And if you take this medication, you're going to have sunburn. And if you're going to have kidney stone, your urine is going to turn what? Orange red. What do you think? Is it retinidine, sulfasalazine, Is it aluminum hydroxide? Is it diphenoxylate atropine or formaldehyde or omeprazole? What do you think? Think about it and select your answer carefully. What do you think? What do you think? If I stop the acid, that means it's an antacid. But I'm going to plug you up because I get constipated, right? And I can use it for renal failure to decrease phosphorus. This is what we use for aluminum hydroxide is what it's used for. This is for anti-diarrhea. Therefore, this medication I got to take, it will help with my diarrhea. It's going to cause tachycardia and dry mouth. This is anticholinergic effect. Therefore, it's this one, diphenoxylate atropine. This is the anti-diarrhea, which is an opioid. And anticholinergic effect is atropine. It's a 2 medication. So that's what you use for. This causes sunburn, kidney stone, and orange red urine. This is sulfasalazine. It's using Crohn's disease for immunosuppression, but the major side effect is kidney stone, orange red. So you teach the patient not to call you, to drink a lot of water, not to form kidney stone, and wear sunscreen when going outside. With this one is used for ulcers, reflux, but you got to take it at night. You should not smoke. This is retinidine and formaldehyde. It's not the same thing as omeprazole. Omeprazole, smoking does not affect the use of the medication. At the same time, you cannot take it at night. There's no need. You can take it anytime you want. So the last one, number 12, is H2 blockers, ranitidine and formaldehyde. Those are the medications. Pharmacology 101 in an easy form as much as possible. These are all GI medications. I use it for anti-diarrhea. If I take it, my tongue is going to look black and my stool is going to look black. And if you're a kid, I give it to you, you're going to have Rey syndrome. I can use it to treat C. diff, trick. You should avoid alcohol because you may have disulfiram reaction. It causes metallic taste and your urine turning to dark. All the side effects of that medication. It's a bulk forming laxative. Which one is bulk forming? And you have to drink it with a full glass of water. It's an antiemetic. I use it for nausea. It blocks dopamine. Therefore, there is a risk of dystonia and akathisia. What do you think? What do you think? It's an antiemetic. Look at it. Which one is antiemetic? I see promethazine here, right? That's the only antiemetic I see here. It blocks dopamine, and there's a risk of dystonia and akathisia. These are extrapyramidal side effects related to the antiemetic. A bulk forming laxative, which one? It's a psyllium. Docosate is not bulk forming. Bisacodyl is not bulk forming. So those ones are wrong. It's psyllium, and you got to drink a lot of water. Which one is used to treat C. diff or trichomonasis? And you should avoid alcohol because you're going to have disulfiram reaction. It has metallic taste, and your urine is going to get dark. What do you think? Can you guess which medication is that? Metronidazole. You can stop the video, select your answer choice, then see the way I'm going to explain it. So if the NCLEX give you a question on metronidazole, know that it's used for C. diff, it's used for trichomonasis. You should avoid alcohol. It causes metallic taste, and your urine is going to take dark. That is the way to answer this question. This is anti-diarrhea. Therefore, pick a medication that if you have diarrhea, you can take it. But it's going to cause Rey syndrome in kids. What do you think? You know Rey syndrome is because you give a kid salicylate. I see bismuth subsalicylate. Therefore, I'm picking that answer. And the last group of medication. I used to treat esophagus varices. There is a risk of bradycardia and abdominal pain. If you take it for weight loss. Your stool is going to be oily and you have a lot of flatulence. Therefore, take it with low-fat diet. I use it for IBS. It causes dry mouth, blurred vision, constipation, and urinary retention. What do you think? We use it to treat traveler's diarrhea and then hepatic encephalopathy. Is it dicyclomine? Is it octreotide? Is it orlistat? Is it rifampicin or polyethylene glycol? 20 medication, GI pharmacology medication to keep you focused. Easy way to remember them. Which one is used for traveling diarrhea and for hepatic encephalopathy? This is rifampicin. This is the medication. This one is used for IBS, and you have anticholinergic side effect. Mouth dry, blurred vision, constipation, urinary retention. These are all anticholinergic effects. That's dicyclomine. Use it for weight loss. And you're going to have stool that is oily and flatulent because it blocks fat absorption. And you should take it with low-fat diet. What is that? Orlistat. And then finally, esophageal varices. This is the medication used to treat esophageal varices, and it causes bradycardia. This is octreotide. Therefore, 20 medication, know them, put the NCLEX, and you'll be fine. Hepatic encephalopathy and diarrhea, rifampicin. IBS with anticholinergic dicyclomine. Weight loss, oily stool, orlistat. Octreotide used for esophageal varices causes bradycardia. What? Antiemetic and blood dopamine have EPS, promethazine. Buckformin, psyllium. Medication used to treat C. diff, trick, and it has disulfiram reaction, metronidazole. It's anti-diarrhea with Rey syndrome, bismuth salicylate. Look, for GERD, you take it at night, smoking is not good. Retinidine, famotidine. Sunburn, kidney stone, orange red urine is sulfasalazine. It's a sulfur drug reaction. Anti-diarrhea against diarrhea and have anticholinergic effect, diphenoxylate and atropine. If you stop taking it, it will plug your acid. It will take care of your acid, but you're going to get constipated. Aluminum hydroxide is an osmotic laxative. Based on that, it has to be magnesium hydroxide, not docosate. It's contraindicated in pregnancy, misoprostol. But if you have NSAID, you're taking NSAID, you can take it with it for gastric ulcer. QT prolongation, SSRI for antiemetic on dansetron. And if you're taking 1 hour before meal and you get constipated, sucralfate. And the last group, osteoporosis, C. diff, pneumonia, this is the ZOS, PPI, omeprazole. If you have ascites and your ammonium is high, I give it to you and I try to titrate your stool to a goal of 2 to 3. This is what? Lactulose. You should not take it if you have C. diff and if you have diarrhea. That is what? Loperamide. And we use it, if you take it, you're going to have diarrhea and lip smacking and tremor. There's 2 medications, promethazine and metoclopramide. It's only metoclopramide that causes diarrhea. Promethazine does not do that, but they both causes lip smacking and tremor, which is extrapyramidal side effect. 20 medication. Thank you for watching. This is Adapt NCLEX. Good luck. If you like this video, subscribe to Adapt English for more content like that, or put a comment if you agree with any medication or you have any questions, and put a comment and then let me know. Take care of yourself and have a good day.